Hello, everyone. Welcome back to our channel. Today, we're tackling an important health topic: calcium deficiency. We'll discuss its symptoms, causes, and how you can address it. Let's jump right in. First, let's talk about calcium. It's a vital mineral for building strong bones and teeth, aiding muscle function, and supporting nerve transmission. It's also essential for blood clotting and heart function. But what happens when your body doesn't get enough calcium? Calcium deficiency can manifest in various ways. Here are some common symptoms to watch out for: muscle cramps and spasms, numbness and tingling in fingers and toes, fatigue and weakness, brittle nails and dry skin, dental problems like weak teeth and cavities. In severe cases, heart irregularities or seizures. What causes calcium deficiency? It can result from dietary insufficiency, not consuming enough calcium-rich foods. Vitamin D deficiency. Vitamin D is crucial for calcium absorption. Medical conditions, such as kidney disease or gastrointestinal disorders. Medications. Certain drugs can interfere with calcium absorption. Hormonal imbalances, such as parathyroid gland disorders. The good news is that calcium deficiency is manageable. Here are some solutions. Increase calcium intake. Consume more calcium-rich foods like dairy products, leafy greens, almonds, and fortified foods. Vitamin D supplements. To aid calcium absorption, exercise regularly. Weight-bearing exercises can help improve bone density. Calcium supplements. Only take them after consulting a healthcare professional. If you suspect you have calcium deficiency, it's crucial to seek medical advice. A healthcare provider can perform tests to confirm and recommend an appropriate treatment plan. That's all for today. We hope you found this video informative. Remember, maintaining proper calcium levels is essential for your overall health. If you enjoyed this video, give us a thumbs up and subscribe to our channel for more health-related content. Take care and see you next time.